Welcome back to KCHC Pulse podcast. I'm your host today. My name is Heather Maldonado, and I am our Patient Assistance Manager here at Kinston Community Health Center. And I am got a guest speaker with us today, Miss Stephanie Taylor. She is one of our nurses here at KCHC, and she is also our Director of Quality, Compliance, and Risk Management. You may have seen us at our recent health fair that we did this year, covering colorectal cancer. And that's kind of what we're going to be talking about together today, Stephanie and I. I've got some questions to ask her because we are coming up on March, which is Colorectal Cancer Awareness Month. And so she's going to introduce herself and give us a little bit about her background, and we're going to start talking about colorectal cancer.
Yeah, so hey everybody, and thank you, Heather, for having me today. As you mentioned, I do quality, compliance, and risk management here at the Health Center, and been working in quality for a couple years together. So we've had a chance to partner,
Yes.
with colorectal cancer and just trying to bring some awareness about that to our patients. And so I'm excited to be with you today and talk about it.
Okay, well, thanks, Stephanie. So we're going to start with just a couple questions, and the first one's going to be what everybody wants to know is, why is colorectal cancer screening so important in a community health center setting?
Yeah, so I think one of the reasons that it's so important for our patients is because, the earlier that our patients get screened, the earlier we can detect something that's going on, and the better their treatment and outcome results are going to be. So, for our community, it's important for them to be able to have that access to those screening tools, and we'll talk about those a little later in the podcast today, but I think the early screening is just the most important piece so that, we can detect something and make sure that we have better outcome.
Okay, that makes sense. And so who do you think needs to be screened, and at what point do they need to be screening for colorectal cancer?
So the American Cancer Society recommends that patients start their screening at age 45.
Okay.
And so typically you do screenings from age 45 to about age 75. And then after that, it's going to be kind of talking with your provider and making some decisions there about, how often you're going to continue those screenings after that.
Okay.
Now that is the recommendation for patients. Of course, if you're considered a high-risk patient, and that meaning maybe you've had a personal history of colorectal cancers or maybe polyps, you have a family history of that, or if you're just having some issues such as changes in your bowel patterns, abdominal pain, different things like that may indicate that you need screening earlier or more frequently.
Okay. And so what are the different screening options that patients have? I mean, I know you mentioned it's got a lot to do with risk factors and things like that too that come into play, but can you just elaborate a little bit more on their screening options?
Yeah. So there are a couple different options that you can choose for colorectal cancer, and of course you'll be able to talk with your provider about that. The two most common ones that I think of are going to be your Cologuard screenings and then colonoscopies. So a Cologuard is actual tests where you collect a stool sample at home. They send you a little box. You collect that sample, send it off, and that checks for DNA markers in your stool or blood. I will say their website has their statistics on there. It's 92% effective at identifying colorectal cancers early.
Okay.
So that's a great thing there. And then of course, colonoscopies, that being set up with your GI, and that's your gastro specialist, and they'll bring you in and they'll put you to sleep, and they'll go in and take some imaging and stuff like that. And so those are typically good for 10 years, and your Cologuard is good for 3 years.
Okay.
So.
Okay. Well, that sounds great. So the Cologuard, they actually don't even have to go to a facility to have that done. They could do it in the convenience of their own home.
Correct. Mm-hmm.
Okay.
Yep, they can do that right at home.
And now what happens if that Cologuard test comes back positive for the patient? What is their next steps after that?
Yeah. So just because your test comes back positive, it doesn't mean you have cancer. It just means that we need to do some further testing and evaluation. You'll want to follow up with your provider. They'll probably get you set up with a gastroenterologist, a specialist for that, and they'll probably do a colonoscopy at that point to really get some imaging and see what's happening.
Okay. Can you tell me a little bit, Stephanie, about some barriers that we see most commonly here as far as patients who are wanting to be screened and things like that? Like, what are barriers that we see that they face?
Yeah. A couple of things that just come to mind for me is, transportation can be a barrier for patients. If you're doing a colonoscopy, you're needing somebody to take you for that procedure. Somebody's going to need to transport you home afterwards. And so for some of our patients who don't have that transportation, that can become a barrier for them.
Right.
Another thing, that I think of is financially. If you don't have insurance that's going to cover the cost of a colonoscopy, those can be very expensive. And so what we do have here at the health center, we have an agreement with Cologuard. And so we are able to offer those Cologuard tests to our patients at no cost. So if their insurance doesn't cover or they don't have insurance, we can get that screening done for them for no cost.
Okay, all right, good. So we've got some options, for our patients to work with.
Yes.
And something that we hear, very often from our patients is, I don't need the screening. I feel fine. I'm doing okay. I don't think I've got anything going on. What would be some, word of advice that you would give those patients who say that they feel fine or they feel normal and they don't need this screening?
So I would just say, you feel fine right now, and everything's good right now, but that doesn't mean that there's something, not something going on. And so remember, the importance of getting those screenings is to early detect. So maybe you're not having any symptoms, nothing's really happening, so you kind of put it off for a little while, but the earlier we can detect something that's going on, the better we can treat it. So again, it just kind of goes back to that early detection there.
Okay, and as far as, leaving our audience with a little piece of advice, what would be something that you would tell our, patients or the audience listening regarding the colorectal screening?
I would say, just get your screenings done. It again is very important to be able to identify things early. You have those better outcomes. I was looking at the American Cancer Society's website earlier, and the statistics for 2026 show that there'll be over 100,000 new cases of colorectal cancer in the year 2026.
Yeah.
That's their estimate. So very important to get those screenings done. That way you can get, set up for any kind of treatment that you may need.
Okay. Well, thank you so much, Stephanie. I appreciate you taking the time to come on and answer some questions for us. So, you heard it from Stephanie herself to, give us a call, schedule those appointments, and we can help you determine, what kind of screening is going to be better fit for you and making sure that you're getting that done. So, that's all we have for today. Thanks, everyone.
Thank you.